Hello, I'm Elizabeth O'Donnell, and I've just recently completed a doctoral research study through Lancaster University that explored how care home staff in Ireland manage responsive behaviours of care home residents with dementia. And I'd just like to talk you through my research. And I'll just start off by talking about the background to my study. Many care home residents with dementia exhibit responsive behaviours such as aggression, agitation and wandering. Psychotropic drugs, for example antipsychotic drugs, are often prescribed to manage responsive behaviours. However, studies have shown that these drugs have limited effectiveness and triple the risk of developing a stroke and double the risk of death in people with dementia. Therefore, guidelines recommend taking a non-pharmacological approach to managing responsive behaviours. However, implementing non-pharmacological interventions in the context of COVID-19 may be challenging due to reduced staffing levels and may result in increased prescribing of psychotropic drugs to care home residents. Therefore, the aim of this research is to understand how care home staff in Ireland support residents with responsive behaviours during the COVID-19 pandemic to identify the barriers and facilitators to taking a non-pharmacological approach. An ethics approval was obtained from Lancaster University and all participants provided written informed consent. In total, 25 interviews were conducted with care home staff from 21 private and voluntary care homes across Ireland. 16 interviews were conducted with managers, 4 interviews with nurses, and 5 interviews conducted with healthcare assistants. Thematic analysis was applied to data to conceptualise how care home staff support residents with responsive behaviours and the barriers and facilitators to take a non-pharmacological approach. So I just now like to talk about the findings of the research. During the COVID-19 pandemic, care staff explained that social isolation associated with the ban on family visits created fear, anxiety, low mood and sleeping difficulties for many residents, with increases in responsive behaviours reported, particularly in homes with COVID-19 outbreaks. Care staff in some homes reported using psychotropic drugs more often to manage responsive behaviours, particularly if residents were distressed or exhibited aggressive behaviour. In other care homes, care staff reported that they didn't use medications more often to manage responsive behaviours, but staff explained it was important to understand residents' personal history to identify the triggers for responsive behaviours and organise activities in small pods of 4 to 5 residents, facilitating a non-pharmacological approach to supporting residents. In some care homes, this was challenging because during the COVID pandemic, care staff were recruited from private and voluntary nursing homes by the Health Services Executive, the HSE, to work in the acute hospital settings in Ireland. Therefore, government supports for care homes should ensure that the HSE do not actively recruit care staff to public healthcare settings if future crisis situations arise. The findings also highlighted how some care staff, particularly healthcare assistants, feel that they're not valued in their role, and poor communication with nurses impacts on teamwork, motivation, and the implementation of a non-pharmacological approach to managing responsive behaviours. The findings also show that despite healthcare assistants' in-depth knowledge of residents, they're often not included in decision-making about how to best support residents with responsive behaviours. So inadequate staff training in person-centred care and inadequate collaboration poses barriers to implementing non-pharmacological approaches to manage responsive behaviours, while effective leadership and the inclusion of family members in decision-making and access to mental health team support facilitates a non-pharmacological approach to support residents. However, it was noted that it's difficult to access psychiatry services in rural regions of Ireland compared to urban areas. So this study recommends that nurses and healthcare assistants require further training in dementia care as part of their education programme, and opportunities should be provided for collaboration and equitable decision-making. These recommendations will assist development in the Irish National Dementia Strategy to facilitate implementation of non-pharmacological approaches to manage responsive behaviours and improve care for residents with dementia. So I'd just now like to thank you for your attention. I'd also like to thank my supervisors, Professor Carol Holland and Dr. Caroline Swarbrick at the Centre for Aging Research, Lancaster University, for their help and support. And I welcome any questions you may have. Thank you.